Thank you, everybody. It's a great pleasure to be presenting today on one of the aspects that Sarah Alvarez has mentioned in her presentation. So we are going to go deeper into one of those lines she explained, which was Panchakarma. So Panchakarma is the Ayurvedic system for deep biological and emotional reset. For me, it's a fascinating topic because it goes into deep detoxification of the body. It's a millenary-old system of detoxification. However, it's the most advanced detoxification process that we have available these days. So I practice as an Ayurvedic health consultant. I've been trained in Siddha Veda under Dr. Smita Naram, and I've been also practically trained in Panchakarma in India at the Ayurveda Guru Hospital. I also practice traditional medicine, and I'm recognized by the Indigenous Council of Colombia as a doctor. I've studied Western herbalism, traditional alchemy, and I'm also a Reiki master. My focus on healing is on detox, rejuvenation, and emotional and spiritual healing. So I'm going to be repeating definition and the meaning of Ayurveda, which is the science of life. And I think from Sarah's presentation, we got an idea on how vast is Ayurveda and how many aspects it covers. And what it seemed very simple in her presentation, just lines of topics and fields, each one of them could take us several lifetimes to master. So if you ever want to get lost in knowledge and understanding life, we welcome you in Ayurveda. Please be our guest. So it has a holistic scope. It integrates the body, the mind, the spirit, and the connection with the environment. Our health model doesn't seek a body absent of illnesses. What it seeks is taking the individual back to their balance with themselves, with their mind, with their emotions, and with the environment, with the seasons. So a very important part is going to be the prevention through lifestyle and diet. Another important aspect of Ayurveda where our ancients were way ahead of their time was about rejuvenation. So right now, biohacking is like the trendy word, and it's been done in Ayurveda for over 5,000 years. Systemic rejuvenation, Rasayana. And our focus is treating not generally illnesses, but the individual. Ayurveda is as relevant today as it was 5,000 years ago. It's the science of common sense. And common sense, it's the most uncommon sense we have these days. We live in the age where we have all knowledge available. And we have so much knowledge that we have lost perspective. So Ayurveda helps you bring you back to what makes sense. So why detoxification is important today? I can imagine everybody here in this room is acquainted with chronic inflammation in their patients, and this inflammation as the root cause of so many diseases. We are constantly exposed to environmental toxins in the air, in the food, in the water. Our senses keep being bombarded with excess information that we cannot digest. And that's why it's important that practices like breathing, transcendental meditation to help us process all that influx in our senses. So as a consequence of this bombarding of environmental toxins, mental toxins, emotional toxins, our digestion becomes weaker, our metabolism slows down, and that means our body starts accumulating toxins in the tissues. And the body starts playing this game of, where do I put this that doesn't belong to me? Can I put it in fat? Can I put it in muscle? Can I put it in the bones? What about pushing it to the nervous system? What about in the brain? And it's this game of hide and seek. So all these excess toxins start playing this game of hide and seek. So Panchakarma, it's a very systematic program of cleansing at the physical level and also at the emotional level. The main target is going to be to reset digestion and metabolism, and to restore the natural capacity of our body to heal. So the Ayurvedic perspective on disease, it's that we create this method of relocated toxins. We call them ama. The ancient wise men that passed us down the Ayurvedic system, they saw these toxins as a sticky product, undigested products from our emotions, from our food, that slowly start obstructing our tissues and channels. That means not only the physical channels like our veins, but also more subtle channels that we cannot see with a microscope. And these obstructions are what create all chronic diseases. So main core of our actions is going to be recovering the digestive fire, which we call Agni. This digestive fire is not only our digestion, but we have several different types of digestive fire. As I was saying, we have a fire that digests the senses we receive, the stimulus we get through our senses. And another aspect of Ayurveda is that we consider there are three main regulatory forces that we called doshas. And they are Vata, which is in charge of movements, things like the nervous system, everything that is dry, everything that is rough, everything that is moving, everything that is cold in your body is going to be regulated by Vata. The second regulatory force is Pitta. Pitta is in charge of transformation, digestion, metabolism. It's your drive, it's your fire to act. And the last one is Kapha. Kapha gives you structure, stability, immunity. So in these three forces, there's no such a thing as this is the good one, this is the bad one. We need all of them, and all of them play a part through our life. So Vata is usually more relevant when we enter the later age in our life. This is the main force that will start basically just destroying our tissues in a way, and it's in charge of decay, but it's also in charge of all the elimination in your body. Pitta is relevant, in your 30s when you need drive, when you need to achieve things, when you need sharp thought, analyzing thought. However, when it's out of balance, it's going to give you excess heat, and excess heat is going to be inflammation, redness, again, chronic inflammation. Kapha is what makes you grow when you're a child. It builds that structure. But what happens when Kapha is out of whack? We get obesity, lethargy, we slow down. We cannot think properly. We have fogginess in our mind. So what we try to achieve is to keep these three forces in check and in the right balance for your right constitution, because maybe the right balance for you is not the same than for you. So the target is going to be different. So Panchakarma means 5 actions. It's a process of a structured detoxification and rejuvenation. We remove toxins, we rekindle the digestive fire, we regulate the doshas. All processes in Panchakarma follow the same approach. We are going to have a preparation, we are going to have the main therapy, and aftercare, it's as important as the main therapy. So normally, majority of medicines just do the target, just do the action. And then you are left on your own devices. But for us, when you go through such an intense process of healing, your body remains very weak. It's as if you clean the floor and it remains wet and you walk after that. You have the risk of falling down. So it is the same for us. Whenever you undergo a complex healing process, you need to pay as much attention to the post-care of the body. So the phases for Panchakarma is going to be preparing the body for eliminating those toxins. And usually this is done through internal oleation with oils or ghee, which is clarified butter. We also use things like herbal steam and sweating. And we also use massage to mobilize the toxins through the gut. So the main therapies for Panchakarma are purgation, emesis, medicated enema, nausea, which is going to be nasal therapies, and bloodletting, sometimes done through leech therapy. So these are usually very shocking techniques for the Western mind. Usually we see vomiting as a sickness. We don't see vomiting as a method for healing yourself. So this is the fascinating aspect of Ayurveda, almost alchemical, where you can use something that is seen as an illness as a therapy. So the aftercare, as I was saying, you're going to be left in a very delicate position after eliminating, basically grabbing all those toxins from all the hidden spots. You bring them up and then you try to move them out. So your body is going to be very weak. So you're going to start walking like a baby, right? So your food is going to have to be like a baby, the same process when you were a baby. When you're born, you don't start eating steak or vegetables. You start on milk. So this is the process we follow after Panchakarma. So we reintroduce gradually different groups of foods, and also we use herbs that will help you rejuvenate. So the preparatory measures are going to be internal oleation. That means, again, something very strange for us. Drinking fat in reasonable large amounts until you're completely saturated in fat. You're going to feel greasy everywhere. So the therapy is going to start drinking a little bit of ghee or oils. And that's going to start pulling those toxins to your gut. So all the toxins that are fat soluble are going to start be moved to your gut. All this oleation is going to lubricate the tissues and loosen the toxins. We also use external oleation with body massage, which is going to enhance circulation and it's going to relax the muscles and the fascia. So that facilitates that everything that has been constricted can come out. We also have heat as a therapy, which is called Svedana. We are going to use steam. What we try to achieve is to open the pores and promote sweating, move the toxins towards the gut, and that makes the preparation for the body. So going a bit deeper into oleation, because most of us have been through the 80s and the fat-free era, right? So in Ayurveda, 5,000 years ago, they thought that sneha, or kind of fat, also meant, back to the meaning of words, love. So put that in context. You know, we've been living for so many years on fat-free yogurts and fat-free milk. So why will be fat so important in Ayurveda? So nowadays, we know, for example, that the only way to cross your brain barrier is through fats. So that's why they knew 5,000 years ago that fat is also a medicine, depending on the amount you use it, depending on the type of fat you are using, depending on the type of person you are using that fat. So we ingest oils or clarified butter, sometimes medicated with herbs, again, indicated for the person. We need to consider how strong is the digestion, because you need to be able to digest whatever it is. Whether we are talking of a supplement or a medicine, if you cannot digest it, if you cannot integrate it in your body, it's useless. External massage and toxins are drawn towards the digestive tract. I'm afraid there's been some glitches with the presentations today, but I was having a few pictures of the different types of oleation that we use. Local Basti is going to put oil on certain parts of the body to lubricate the tissues. This is very important in cases like paralysis, for example, to being able to nurture the tissue from outside when you are not able to do it from the inside, because maybe the digestive system cannot process that amount of medicine. Shirodhara is probably, you know, if we think about Ayurveda, is probably what you think of the first time. You will have seen, you know, this beautiful picture of a pot, and there's a drip of oil on top of your third eye. And this is Shirodhara. Again, it's using oil to calm the nervous system and the internal oleation. So going a little bit deeper on the mechanisms of oleation, because when we present this therapy to patients, it's very difficult to make them understand that they maybe need to drink 200 ml of fat in a day in one gulp. So there's going to be a temporary rise in your blood lipids, obviously, if you're drinking a lot of fat. But the studies have found that your body adjusts to this process. And after you go through this process, what we find is that actually your metabolism is going to improve, and it's going to be a kickstart to your liver. It's going to say, hi, you need to produce more bile. So this process is safe for healthy individuals. There's no adverse impact on liver or kidney function. And again, the paradox, it facilitates weight reduction when you follow by purgation, which is, again, against the logical mind that if you eat fat, you're going to gain weight. After the process, your lipid profile is going to improve and is going to reduce the inflammation markers in your body. So the next part of the presentation, of the preparation for Panchakarma is going to be fermentation. We call it Swedana. So what we are going to do is increase the heat in the body. This is going to be done through different methods, from the most basic, which is going to be exercise, to a lot more complex processes. So this is going to help liquefy and modify and mobilize your toxins. It relieves the stiffness, heaviness, and pain. We can use a steam therapy with herbal steam applied to the whole body or locally. We use inda or bolus. These are small bags with herbs or rice that we apply locally, and we do massage on the whole body with these small pouches of herbs. There's going to be also herbal baths or pouring liquid over the body, depending on the case. So this therapy, what is going to help is going to reduce kapha. We were talking in the beginning, it's like fat, and a slow metabolism is going to kickstart you. And also it's going to act in vata, in your nervous system. It's going to promote relaxation and flexibility. And we're going to start with the first elimination process, which is called Vamana, and it is basically therapeutic emesis. So it's going to be a very controlled, under a qualified person, therapeutic induction of emesis. So the purpose is going to be excess the mucus and toxins from stomach, lungs, and sinuses. We are trying to target the excess kapha, which are the qualities of heavy, cold, sticky, and sluggish in your body. It's going to help clear all the respiratory and upper digestive tract. And it's going to give you a lot of lightness and clarity. The general benefits are to relieve congestion, allergies, and respiratory issues, improve appetite and digestion, and promote mental clarity and emotional release. And I would like to bring you to a comparison to an illness, which is bulimia, which is kind of the uncontrolled way to do Vamana. So when someone has bulimia, in a way, the hurting process, which is binge eating, is combined with the therapeutic measure. However, obviously, we understand that that's not a way to do it. But in a way, we see the same process in animals. When they eat too much food, they will go outside and search for certain herbs and purge themselves. So Vamana is conducted after 7 days of oleation and fermentation. And we are going to be drinking a lot of ghee. The toxins are going to be flowing to the gut. And on the procedure day, certain herbs with emetic properties are going to be given. So we use herbs like Madana Phala, Acorus calamus. We use a lot of licorice decoction, and we drink this in large quantities, and that's going to promote the vomiting. This is used for asthma, chronic bronchitis, allergic rhinitis, sinusitis, all kapha type related obesity with slow metabolism, heaviness, and skin diseases linked to kapha excess. Again, that's nothing to be done at home. Please seek the advice of a professional in this field because it has several risks linked to it. So we have cleared the upper tract. So now we're going to go down the lower tract. And that's where Virachana comes in, which is purgation. So in purgation, we are going to be using herbs with laxative properties. and also always medicated ghee with the same properties. So when we are doing purgation, we are going to focus on the heat. So this is going to be when we have a lot of heat in our liver. When there is anger, unresolved issues of anger that get stored in the liver, this is the therapy. Anything that is heat, red, that's where Virchana comes in. So Virchana helps with systemic inflammation. It has incredible effects on your skin complexion and also on your digestion. It helps in acidity, gastritis, liver congestion, inflammatory skin conditions, and promotes calmness and emotional balance and clarity. One of the interesting things is that when patients go through these processes, when they are clearing these toxins, it's very common that emotional states from the past will come out. And these are very intense processes. When I'm talking about purgation, we are talking about maybe, I'm sorry for being a bit gross, but welcome to Ayurveda. We are talking about maybe going to the toilet like 15 to up to 30 times in a day. So it's intense. And you can experience that in each one of those times you go to the toilet, an emotion, a trauma can come up. So the process is going to be the same. There's going to be oleation. There's going to be fermentation and heat. And there's going to be repeated bowel movements, elimination. And as I was saying, it's going to work on acidity, gastritis, liver, gallbladder, inflammatory conditions, metabolic syndrome, obesity linked to inflammation, eye conditions linked to heat and inflammation. And we move to the next process in Panchakarma, which is Bastis. It's 1 hour. How much time? Half an hour. Ah, okay. Yeah, I was panicking. So basically, Bastis is going to be medicated enemas. And the interesting part for Ayurveda is that we use them in 2 different manners. One is scraping, and one is nurturing. So this is very different than when we think about enemas in the West, which is used when you're really constipated, you need to get it out, and you will be given an enema. Here, again, enemas are used as a way to direct medicines when your stomach cannot process them. They are going to be used to relieve constipation, gas, abdominal pain. They improve the joints, the muscle function. They help reduce anxiety, restlessness, and insomnia. And I'm sure you know when you are stressed, the first thing that is going to resent in your body is going to be your digestion. If you have a huge trauma, you don't want to eat, you get bloated. So this is why through Bastis, we go on the opposite direction. So basically healing from down upward. So there is 2 types of Basti. One is going to be with a larger concentration of oils to nourish, to lubricate, to calm all the dryness in your colon. And that's called Anubhastana Basti. And there's another type which is going to be basically with scrapping herbs to clean. And this is called Niruha Basti. It's a detoxifying type of enema to help you flush your toxins. There's another type of Basti, which is the aim is to achieve longevity and nourishment. And Matra Basti, it's a very interesting one when you are going to use small amounts of oil for almost daily nurturing. This is very useful on elderly, for example, or on people that do a lot of physical exercise. This will be great for bodybuilders, for example. Basti is also useful for arthritis, sciatica, lower back pain, neurological conditions, paralysis, multiple sclerosis, anxiety, insomnia, and chronic fatigue. They must be adapted to the person. Not everybody can take the same amount of Basti. And we are moving through the fourth type of therapy that we use, which is nausea. And it's going to be cleaning all your sinuses. So basically, we are cleaning every single area of your body. And nausea, same as Basti, we have scraping techniques and nurturing techniques. In Ayurveda, like 5,000 years ago, they believed that the nose is the gateway to your brain. So through nausea, we can treat everything that happens from here upwards. Any kind of pain in your neck, any kind of tension, anxiety, insomnia, sinusitis can be treated by pouring oil or medicated herbs into your nose. It has direct effect on your brain, pituitary, and hypothalamus. So how we do nausea is basically we are going to do massage and steam therapy, applying to your face, your head, sometimes the chest. The patient is going to be laying down, and we proceed to pour a certain amount of oils or medicines through the nose. And we move into bloodletting, which is the last part of detoxifying your body. And I hope by now you understand how thorough we are at cleaning the body and every orifice you have. So recta moxa bloodletting is the therapeutic removal of small quantities of blood to reduce toxicity and inflammation. We are going to be targeting the excess heat mainly. That's pitta. So that's going to be the hot, sharp, and acidic qualities in your blood. It's going to be clearing toxins from your circulation, reduces local congestion and heat, improves microcirculation and tissue oxygenation. It works wonders. We are going to see a case later on eczema, psoriasis, acne, joint swelling, gout, and abscesses. So again, we need to go through preparatory process, and basically we can use either things like needles or something even more fancy, which is going to be leeches. And on day 10, I do recommend you watch the presentation by Albert Kraseniuk. He's worldwide leading expert in hirutotherapy. And his research has completely changed the way we see leeches. We can see that by interacting with an animal like a leech for healing, your biofield changes. We know now leeches emit small radio frequencies. They kind of sing a song whilst they bite you. Yeah, so fortunately, we are at the age that science, it's giving background to what we thought it was wackery and suspicion. And, you know, the ancients knew it worked and they did it and they used it. And then at some point, people thought, this is not possible it works because I don't know of any mechanism this can work. So we will stop using it. Luckily, some people believed in what they were doing and they continued and they have passed this knowledge. So Rakta Moksha works really great in eczema, psoriasis, acne, inflammation, ulcers, diabetic foot, fantastic. Whenever there is a problem with circulation, you have tried everything. This is your last resort. Varicose veins, obviously there's a lot of contraindications. So if you have any clotting issues, don't use leeches. If you are using any medicines to avoid clotting, this could not be used. In Europe, post-COVID, post-vaccines, the sales of leeches rocketed. I won't say any more on that. So aftercare, you can see now it's a very strenuous process for the body. So you're going to be very weak. And you need to, you cannot do like 2 weeks of Panchakarma and go back to your life. You need to continue. That's a very Western approach. It's like, oh, I'll do 2 weeks of Panchakarma. I'm going to India and then I fly back and next day I'm jumping onto a meeting. That's not the way to do it. You need to allow some time for rejuvenating your body. So the process of rejuvenation in Rasayana is to restore vitality after cleansing, rebuild your tissues. So we are taught that our tissues degenerate with time. Ayurveda says, no, once your digestive fire is back on track, you can rebuild healthy tissues. We are going to use herbal tonics, formulations like Chyawanprash, medicated ghee. And we help people get back into seasonal routines, eating what's in season, having practices that are back in season, like, you don't swim in winter, common sense things that we have completely forgotten about. And the benefits are going to be improved energy, stamina, and longevity, better resistance to disease, and enhanced mental clarity, memory, and mood. Psychological and emotional benefits we see with Panchakarma is that the mind-body connection gets reestablished. Not only the body, but also the emotions and thoughts change. So you can imagine that after Panchakarma, there are changes on your microbiome, and we have like 8 kilos of bacteria in our body. So we sometimes think it's us thinking, it's us, our energy, but those bacteria have an energy field. And if you change that community inside you, 8 kilos of you are going to change the way they think, the way they feel. So we create a space for the unresolved emotions to surface and to be processed in a safe environment. There's going to be a feeling of lightness, calmness, renewal, massive changes in how the person lives, even spiritual changes, spiritual awakening on people that, never had any spiritual thought on their life. We have an immense amount of clinical evidence these days that Panchakarma reduces inflammatory markers, improves the lipid and liver function profile, enhances antioxidant status. It's going to be benefiting your metabolic syndrome, things like obesity and type 2 diabetes, relief in rheumatoid arthritis and inflammatory skin disorders, reduction in anxiety, stress, and sleep disturbances. Panchakarma is very relevant in chronic inflammatory diseases, things like arthritis, cardiovascular disease, autoimmune disorders, and it's going to help you restore your digestion and how your liver detoxifies. The role in stress and psychosomatic condition is, I was explaining before, we can see there's a lot of body therapies, a lot of oil that calms the nervous system. So anxiety, depression, insomnia, chronic fatigue get cured. Digestive complaints, headaches, skin flare-ups. And there is scientific research that shows that there's a reduction in cortisol and stress markers. The importance of Panchakarma is, again, it's holistic. It treats every aspect of the person, the body, the mind, the emotions, and it focuses on the root causes of illnesses, not just the symptoms, not just on the label of the illnesses. It's a practice that could easily complement allopathic medicine, and both combined work wonderfully. And we are going to move into a practical case on how this is put into real life. So I'm going to talk about a case that was very challenging for me. And so I'm going to be talking about eczema. So in the Ayurvedic perspective, eczema is its root cause, it's a dosha imbalance, where mainly we have excess heat. I was talking in the beginning, if we are talking pitta, we are talking red heat inflammation. It can have kapha when there is liquid coming out, when there is oozing, and it can have vata if there is dryness. So it can move from a kind of simple illness to treat to a very complex if we have to treat the three energies at the same time, because they are contradictory. So if you put oil to treat one, you can exacerbate the other one. So for eczema, and whenever we have a skin condition, your gut, it's exactly the same as your skin is on the outside. So whatever you are seeing on your skin, it's inside your gut. So the excess toxins are going to find their way to the blood, and they are going to manifest on the skin. So normally what we use to treat eczema is Virechan purgation, which is the best treatment for pitta. Bloodletting, again, the main treatment for blood and skin. We can also use Bastis, enemas, to calm the nervous system if there is anxiety-related symptoms. And we will start, as usual, with oleation, fomentation, and application of medicated oils and paste. For treating skin issues, diet is quintessential. We cannot treat any skin disease with external treatments. What happens is if we have excessive itch on the skin and we suppress it with corticoids, for example, that heat is still present in the body. You didn't get rid of it. You just are going to push it deeper. And it's going to affect internal organs, as we will see in this case. Herbs that we use for skin diseases are going to be things like neem, turmeric, Tinospora cordifolia to detox and restore the immune balance. Aloe vera, which is cooling, Rubia cordifolia to purify the skin, medicated ghee, and there's going to be local application of things like coconut oil and neem oil for soothing. Another aspect of treating skin diseases is that stress management is vital. And we also use techniques of yoga, pranayama, meditation, and of course, regular sleep and avoidance of overheating. So this is the case, the images of the case I treated. Very challenging because it was a patient of 80 years old. So basically, most of Panchakarma treatments, you are advised to stop doing them after 60 years. The majority, because the body needs strength to vomit. The body needs strength to go to the toilet many times. So this was very challenging. The patient had hip surgery, and a lot of steel, well, titanium, was placed in her leg, like literally from his hip to his knee. You could see it was all pins and like an Eiffel Tower. So after this surgery, he developed eczema all over the body. This eczema was absolutely untreatable. It didn't respond to anything. And what was the problem? That the extreme itch didn't allow the patient to sleep. And I was talking about repressing itches and heat. And there were epileptic seizures as a consequence. So I was facing a client that technically could not undergo Panchakarma, but I was facing a client that, because of the itch, could not sleep and was developing epileptic seizures that were causing mental damage. So the approach I took, it was to basically give very, very mild purgation. With the skin disorders, if you are too forceful, if you bring too many toxins out, you're going to get flare-ups. So you need to dose it very carefully. And that was my idea for treating it, using, a little bit of purgation, a little bit of enemas. However, the point came where the sleep became a real issue. And I had, again, 80 years old, and the last resource were leeches. So what we are seeing here is 10 days of difference. 10 days. And we are only seeing 2 parts of the body, but he was fully covered head to toe. So this is the power of Panchakarma. This patient has been free from eczema for 3 years now. He also had blood stasis, and the circulation in his, obviously in the leg that had the surgery, was very damaged. So he had blue toes, and that also improved massively. So conventional medicine, as we probably know all here, manages symptoms with corticosteroids, immunosuppressants, and antihistamines. It's effective on the short term, but recurrence is very common. And when we are using immunosuppressants, what happens is you are leaving the body weak for any other illnesses. So that's why Panchakarma and Ayurveda are such a brilliant way of approaching any illness where the immune system is either overactive or underactive. We target the root cause, the toxins, the weak digestion, the dose imbalance, and we create a personalized system, like I show you in this case, where sometimes you have to, the book says, you cannot do this, you cannot do that, but the case is so severe that you have to push your limits. Panchakarma could easily complement conventional care and reduces drug dependency and improves the quality of life. We have a ton of scientific studies. I give you a couple of slides with some of the key studies I have used for my presentation. And I hope I've given you a deeper view of one tiny line in Sarah's presentation. I look forward to work with you. If you have found anything inspiring in my presentation, anything that you can use in your own practice, please feel free to contact me on my email. I love collaborating. So let's continue the purpose of this conference after we leave Valencia. Thank you so much.